This is In the Public Interest, and I am your host this evening, Linda Johnson. And my guest this evening is Dr. Charles B. Simone of the Simone Protective Cancer Institute. Welcome, Dr. Simone.
How are you, Linda?
Well, I just want to start off by saying happy Thanksgiving to everyone.
Right.
And we know we're all getting ready for what they call Turkey Day. So for that reason, we want to focus tonight on healthy eating and physical activity. Now, according to Healthy People 2010, and for those of you that may not know it, the government put this whole projection out of where we should be. 75% of Americans don't eat enough fresh fruits and vegetables, and of course we're way too inactive, and which brings us, we're going to also touch on obesity. But talk a little bit, Dr. Simone, about the burden of physical inactivity and poor nutrition overall when you talk about good health.
Sure. 65%, anywhere from 50 to 65% of our American population, young and old, young people, little people, are overweight by definition. We call it obesity sometimes, we call it overweight sometimes, depending on how polite we want to be, but they are overweight, period. And that's due mainly for two reasons. One, we eat too many calories, which have poor nutritional value, and we do less and less activity as our society changes in what we do. Less labor in our society, more games, more video games, more sedentary lifestyle, at the computer all day long instead of out on the ballpark in the street playing with the other kids. So we're seeing that huge problem, and the burden, the cost to society is enormous. We're now seeing 1 of every 6 people become diabetic, 1 of every 2 men get cancer, 1 of every 3 women get cancer, and obesity is an independent risk factor for everything we just talked about. 2 of every 5 people get heart disease, and again, obesity is an independent risk factor for that. So when you look at obesity and inactivity, you find that the cost to society is about $1.3 to $1.7 trillion a year because of poor nutrition, very poor nutrition, almost malnutrition in fact, with the poor calories coming in, and inactivity. So we can reverse all that because it's not genetic. It's totally preventable.
Now, I know before we leave the air, we're going to go over the Simone 10-point plan because I swear I take that to almost every health fair we go to. It's so easy to follow. But we understand the need, or perhaps we don't, and you've just reiterated the need for more fruits and vegetables.
Yes.
But I think more importantly, because we're getting ready to go into the football season and sitting in front of that TV and just sitting back after that meal, what about inactivity, physical inactivity? I read a report that said that physical inactivity, the lack of activity of being physical, is almost as detrimental as smoking in some people.
Let's look at the reverse. We know that activity, physical activity, will decrease the risk of colon cancer, of breast cancer. Very, very statistically shown now. We know that physical activity will decrease the risk of being overweight, of being diabetic, of getting heart disease. We know that physical activity also will decrease the risk of arthritis and osteoarthritis, big problems. The number 1, 2, 3, 4 problems in our country are related independently to obesity. So we can change that and be active and change the whole situation.
Now, with us becoming more active in our life, can we start to see things turn around?
Of
Is
course.
it ever too late?
Never too late. In fact, studies even at age 55, 60 show that if you decrease the intake of bad calories and increase the activity of the person, you can actually reverse the risk for heart disease, for cancer, for being overweight, for diabetes. You can reverse all this even at late stages of life.
Now, one of the things we always talk about is better health, a healthy lifestyle, which includes diet as well as exercise or physical activity, I'll say. But exactly what burden, what kind of economic burden do you see this placing on society as a whole?
Well, in another 20 years, the cost of health care in this country will be an enormous burden, so big, bigger than the defense budget, bigger than the gross national product in our country, that we will be swallowed by this cost. Our children's children will not be able to bear the cost, the financial cost of this problem. We need to stop it right now, dead in its tracks, because we can change this generation, even this generation, we can change the outlook and hence the cost and burden of the cost to our country.
So are there any disparities that we see between groups of people, cultural groups or racial groups, as far as diet or physical inactivity or physical activity?
I think there are, Linda. You know, we all grow up with our own cultural background, Italian-American, African-American. We all have our own cultural foods identified to us and our way of doing things. And some of the foods are more high in calorie, fried foods and four-legged animals and things like that. So these are high calories with very high fat content and also high risk for being obese, heart disease, cancer, and things like that. So yes, I think cultural are issues, not disparities so much, but rather what we have inborn with our own culture.
Now, I know that we've been on before and we've talked a lot about promoting better, healthy lifestyles. And I know your key is prevention.
That's the only way to do it.
And at this point, we're going to talk a little bit, because we all always like to go over it. And I think I could think of no more appropriate time than now, since it's Turkey Day.
Yes,
and
it is.
Thank God he's not a four-legged animal.
Yes.
So let's talk about the 10-point plan and a little bit about the 10-point plan that you developed at the Simone Protective Cancer Institute.
Well, the first point of the 10-point plan is probably the most important, because we know that nutritional factors are linked to 60% of women's cancers, 40% of men's cancers, and almost 80% of all heart disease, including about 50 to 75% of all diabetes as well. So nutrition is key. What do we do? We avoid four-legged animals. They have all the fat, all the calories, the unnecessary calories and unnecessary fat. We avoid the shellfish, and we get rid of dairy products unless they're skim or non-fat. Now, those are the main three things to avoid. Now, yes, we all like them, but you know, once you start avoiding those three, you'll find refuge in other things, like the two-legged animals coming up, turkey, chicken. Of course, it has to be baked and not fried. Of course, it has to be broiled and not fried. We have swimming fish from the ocean, not the farm, but from the ocean, because the farm-raised fishes are fed the same foods that the four-legged animals are fed. So don't be confused. And those four farm-raised fishes are catfish, trout, tilapia, and salmon. So just be aware of that. So we need to go to swimming fishes, two-legged animals, and all the fruits and vegetables from the earth, including cereals. So these few key pieces of information will decrease the risk of heart disease, cancer, obesity, arthritis, simply based on that. There are huge lines of evidence, global lines of evidence, showing that a high-fiber diet, and the American population consumes about 1/3 or so of the fiber needed to help protect us. A high-fiber diet will decrease the risk of colon cancer, cancer in general, breast cancer, heart disease, obesity, and diabetes. So a high-fiber diet is critical, a low-fat diet is critical, and the use of vitamins and minerals because of this. Our food supply today no longer contains what we think it contains with vitamins and minerals. The USDA did a study published in 2005 showing that vitamins and minerals are less now in foods compared to 1975. So we need to take a supplement, external supplement, a pill of vitamins and minerals. In addition, I'll say one more thing about food before we close. We need to make sure our fruits and vegetables are from this country and not from outside this country. Because outside this country are sprayed all kinds of insecticides and pesticides that are not healthful to us. Our country has laws, other countries don't have the same laws, and we import them because they're cheaper and they get away with the treaty that we've imposed.
You know, Dr. Simone, we're going to come back. We touched just on the adults, but we're going to talk a little bit more about the kids, because I think parents play a very important role for getting the kids out there and from in front of the video games and television and things like that.
But the parents also bring the foods into the house, or allow the children to go to choose and go to the restaurants and or fast food places that have huge amounts of calories. In fact, one more point. When asked, when a person was asked what number of calories they saw in front of their eyes from a fast food place, whether it be a hamburger with French fries and a drink, they underestimated the number of calories by 1/3 to 1/2. In other words, they thought they were only going to consume about 300 to 500 calories in that tray, when in reality it was about 1,300 to 1,500 calories that they were going to consume. So we can't estimate the number of calories properly. We underestimate it and not overestimate it.
Okay. Now we're going to take a break.